so that it's easy for them, because I don't know if I'm always going to be able to be there for everyone around, okay? If I train people, they're as good as I am, because I am that strong about my training. So if you ever hear that I had 8 people that left, because it's being repeated, it's because I am very careful with who I choose. I want the best of the best of the best, and unfortunately, if we're not the best of the best of the best, we don't belong here, okay? So that's really key. Now, what is IPT? IPT means Insulin Potentiation Therapy. What does it mean is we drop blood sugar down to a level where cancer becomes starving. Cancer cells love sugar. If your sugar is not down enough, your cancer cells are happy. So when I drop your insulin down, cancer cells become very unhappy, they're starving, they're really living in a chaotic environment. As soon as I push sugar in with chemo in a lower dose, what happens is the cancer cells very excited and dance, and they open their gates. Normal cells do not need sugar to live. They can get energy from different sources. They can get their energy from fats, they can get their energy from ketones, they can get energy from protein. So normal cells are able to get energy to survive in a different way, okay? Because they're higher being, they're capable to do more. Lower being do less, okay? So people who are living on the very surface can't do anything without just some energy. And sugar gives a lot of very small energy, and that's why you need more and more and more and more of, because and people who don't use energy, that's it. So what do I do during this episode? I work with you and give you insulin, but before I give you insulin, I check. You have food with you?
In the car.
Okay, we gotta get a lot of food as soon as we drop your blood sugar down. So I'm gonna make sure to tell you what the food is again. It has to have eggs. It has to have chocolate, dark chocolate. If you don't, I'll send somebody to go get it.
Yeah, we have some chocolate bars. I can run out and get what we have.
Okay, so as soon as I drop your blood sugar down, I'm being given the chemo at the same time. While the sugar drops down to, we used to do it at 40, now I use it at 60. So every 10 to 15 minutes, I measure your blood sugar, okay? Once you get to the lower dose, I start asking you to start eating, so that you don't, during the time the blood sugar drops, your body starts acting like drunk. You're gonna be like dizzy, maybe sweating, and maybe slower speech, maybe to the point. I'm not trying to scare you. I've never had a problem until very recently, not a problem that is bad. The sugar dropped, the person was not used to the sugar drop, and we immediately give the sugar, he woke up. But it's just like, oh my God, the guy is gone for a minute. Not even a minute, half a minute. But still, it's almost like 10 hours. That half a second is 10 hours. So I try to drop the blood sugar to 60, maybe 40, but never below that. And that'll give you immediately either sugar, we have D50 that we can immediately give you if we need to, or we get you to eat very quickly. Does that make any sense so far?
Mm-hmm.
Okay. So right now, while she's running to get your sugar, just a second, we're gonna check your blood sugar. I'll give you the insulin. I'll access you and give you the insulin, and we start the chemo, and then we get the rest of the stuff going. Now, any questions, any of you, before we start?
First of all, Dan, is our tea the sugar kind like I told